Good morning, everybody. Dr. Zach Long, lead faculty inside of the Fitness Athlete Division of the Institute of Clinical Excellence, coming at you today. It's Fitness Athlete Friday, the best day of the week. And today we're going to talk about the CrossFit Shoulder, which is just an umbrella term that I use to describe this clinical pattern that I see so commonly in CrossFit athletes coming to me dealing with shoulder pain. And I just want to talk a little bit about, what are the positions that I commonly see people with this, what I call CrossFit shoulder. Show them what are the positions that tend to aggravate them, the movements that tend to hurt. And then what are some of the more detailed things we see in our assessment? And then how do I go about treating that? So let's jump right into it. For me, the CrossFit shoulder, what I commonly see is that these individuals are coming to me having pain in movements where they're going into hyperabduction and external rotation simultaneously. So what do I mean by that? I mean, they're having pain with their kipping pull-ups, their toes to bars, their overhead squats, and their snatches. So all of those motions, we tend to have a little bit wider of a grip. We tend to hit these really extreme ranges of motion because of the extremes that like something like an overhead squat puts individuals in, or the kip where they're really moving through the arch and they're getting into that really hyper abducted, externally rotated position. And so those motions tend to be incredibly painful or symptom provoking in those individuals, quite often more so than things like strict presses, push presses, and handstand push-ups. Because in those movements, they tend to have a more narrow grip, and that tends to let some other things in their shoulder tie them up a little sooner in the range of motion so they don't get quite as painful, they don't go quite as much into that hyper abducted, externally rotated position. So again, the strict press, push press, handstand push-up tend to be less painful, or if they have become painful, a lot of times if you dive into it, you'll find that those weren't painful initially, and as they continued to work out, those movements then became painful. Some other movements that you'll see that sometimes provoke their symptoms will be push-ups, bench press, and dips, and that's the anterior dumping of the shoulder that we'll talk about in a minute. That tends to happen with these individuals in push-up type motions as well. But definitely more frequent to have the pain with the kipping pull-ups, the toes to bar, the overhead squat, and the snatches. So if you kind of put a gun to my head and had me tell you what tissues I thought were sensitized, typically they're going to have pain in the anterior shoulder, and that's a lot of times it's going to be the long head of the biceps or their subscap muscle that tends to be irritated, or some combination of that. I really don't particularly care about what the tissue is that is injured, although there are some specific exercises I'll use sometimes when I think somebody's dealing with more of a bicep issue. But I'm a big fan of the shoulder symptom modification procedure. It's something that I use in the clinic a lot because I just feel like when I use this procedure proposed by Jeremy Lewis, then I'm able to really quickly show people that things aren't that messed up. So a lot of times people come to me and they're scared of surgery, they're scared of whatever, as we all get. And if I can do this shoulder symptom modification procedure and really quickly change their pain levels, then that to me is a really good way for me to say, hey, if I can do this simple movement and your pain goes away, then we're going to have no problem getting rid of this, in the next couple of weeks. If you're not familiar with that, I really encourage you to check it out because it's pretty cool stuff. But again, that tends to be anterior shoulder pain, maybe in the biceps or the subscap. And when we look at them move and we take a look at their mobility during these positions of being in this hyperflexion and external rotation. So as I watch this individual do a kipping motion or do an overhead squat, what we'll commonly see is that they start with their shoulder in a neutral position. So if I'm looking at the point of their elbow, it's pointing straight lateral, maybe a little bit anterior. And then as they go down into the overhead squat, or as they get deep into the arch of the kipping pull-up, we'll see them go through this little internal rotation movement there. And you could try to cue them to keep a little stronger in their external rotators, which is a very common cue, and it's kind of debated. I'm sure at some point we'll talk about it on the PT on Ice podcast. But you'll see a clear movement into internal rotation. And then if you can cue them away from that, if you can get them to point the point of their elbow forward or whatever cue you want to use there, a lot of times you'll see their pain goes down a little bit. Or you'll see that they don't have the ability to do that. So a lot of people will lack this in-range shoulder flexion and external rotation range of motion because they have a little bit of tightness in their lats. And just to be stereotypical here, this is typically my male CrossFitters that are coming in after doing years of bodybuilding. They've done lat pull downs and not as much pull-ups, not as much full range of motion training. So their lats tend to be a little stiff on them. And so that flexion external rotation position will be tight, and then they go into a lot of internal rotation as they go into those motions. So that's one thing that I'll really look at from a mobility perspective. If they're dealing with pain in the push-up position or bench press or dips, then I'll look at their shoulder extension range of motion as well, because a lot of times they'll run out of shoulder extension, and then as a result of running out of shoulder extension, they then have to forwardly tilt their scapula as they go into those positions, and sometimes that'll lead to them basically, I think that's just adding compressive forces on the biceps tendon. And so we're putting tension in the bicep tendon and then compressive forces, and as we all know, tendons don't like compressive forces, so I think at times that'll sensitize the bicep tendon. So what do I look for in treatment? Number one, I'm always talking training volume with them. What's been happening here? Have you been trying to work on any specific skills lately? Has the programming at the gym changed to be focused on anything differently? Are you doing like a little specialization cycle where you're working on really improving your overhead squat or your snatch, and therefore your training volume there is highly increased? From there, I look at doing a lot of strict strength things, because unfortunately in the CrossFit community, a lot of times development of strict strength can be ignored. And I want to be really clear when I say this, that that's not the stance that CrossFit headquarters has. In fact, CrossFit headquarters is really adamant that developing strict strength is important and should be done before dynamic movements are added to the equation. But unfortunately, individual gyms and individual athletes tend to ignore those recommendations. So we'll see people jumping into kipping pull-ups before they know what proper kip mechanics are, or before they have proper strict pull-up mechanics. So that's something that's really big for me. In this CrossFit shoulder population, I'm always going to take a look at their kip mechanics. And I'll tell you, 9 out of 10 times here, when I look at their kip mechanics, I'm going to see that they have a really poor kip. They'll either do that internal rotation movement that we talked about earlier, or very commonly, I'll see that instead of them generating the power from their kip from their shoulders, with their shoulders staying in control, they end up generating all that power from their hips. So they're basically just taking their hips and going from flexion to extension, and that makes their body do this big pendulum swinging type motion, and then their shoulders just kind of hanging on and having a lot of force thrown through it that they can't control. Versus what we want to see is that person has good control of going through a hollow and arch position in their back, and they do a good job of initiating the movement of the kip by opening and closing their shoulders down. So their shoulders stay in complete control the whole time. So that is really something that I'll spend a lot of time working on these individuals with, because a lot of times their kip looks good when you're looking at it from an overall standpoint. When you're a coach and there's 15 athletes in the class, this individual's kip looks solid. But when you slow it down and when you look at it one-on-one and spend 5 minutes working on it, you'll see that that they're not quite as good as they look, and they're just putting a lot of extra forces on their shoulder. Guillermo commented here that they also get a lot of knee flexion and extension at times too. Absolutely there. Absolutely. So with these kipping mechanics, I'll basically have these individuals work from doing hollow and arch holds on the ground to we'll do it standing using bands to resist those positions while we're teaching them proper rib cage position and how to use their lats to close the shoulder down. Then we'll go from hanging, where they just hang and then move into a hollow position, hang and move to an arch position. We'll progress that to a beat swing, where they're more quickly moving between the hollow and the arch. And then eventually we'll get them back to doing kipping pull-ups once they have really solid mechanics down in the bottom of that. From a more PT-specific perspective, what are the exercises that I give these individuals to do? There's going to be a lot of posterior cuff work here, because they need a little bit of help resisting what may be some anterior translation through the shoulder because of poor strength in the posterior cuff or mobility limitations. I can't prove that, for instance, and I'm not necessarily telling them that, your shoulder is unstable and coming forward in the socket, but if it's doing that, it's definitely going to be putting some compressive forces on the long head of the biceps there. So a lot of posterior cuff work's needed there. And then one thing that I tend to see a lot of times be missed. So when I become the second opinion for somebody that's done okay in their rehab but not been able to get back to 100%, and they come to me for a second opinion, what I commonly see that is missed by physical therapists in this population is the use of some unstable exercises to really build some confidence in their shoulder stabilizers. So I'll have them do bottoms up presses, bottoms up carries, kettlebell arm bars, whether that's with the bell down or the bell up. We'll do hanging band technique work, where I'll take a PVC pipe or a band bell barbell, a special type of barbell, and I'm hanging weights from bands from it so that those implements are just incredibly unstable. And then I get them training in those positions that they're having pain and discomfort in. And that combination of using these unstable loads and really trying to beef up the posterior cuff and improving their movement mechanics tends to have these athletes doing really, really well here. I did a podcast here on PT on Ice probably 2 months back on a bunch of different exercises that I like to use in this population. So if you want more exercise ideas, go back to that podcast. I think one other thing that's really important to use in this population is let's get specific to the tasks that they're going to be facing. So in CrossFit, they're going to go do a 10-minute, 15-minute workout where during the course of those 15 minutes, their shoulders being taxed in very different ways. Maybe they're doing something like pull-ups combined with overhead squat, combined with push-ups or kettlebell swings. So that shoulder is constantly working over the course of these workouts. And so what I don't want to do is just program them, all right, do 1 set of 10, rest a minute, do your second set of 10, rest a minute, do your third set of 10. While that might be what I do early on, I'm really a big fan of progressing these individuals to these rehab EMOMs that Dr. Mitch talks about so much, where basically we set a timer with that individual and we say, minute 1, you're going to work on your beat swing. You're going to work on proper mechanics there. Minute 2, we're doing TheraBand external rotations at 90 degrees. Minute 3, we're doing a bottoms up kettlebell press. And we're just combining some different ways of loading the shoulder and taxing the shoulder. We're building strength while at the same time we're also working on what the shoulder is going to see in a CrossFit workout. Its ability to maintain strength and proper mechanics under fatigue. So I think taking it to that specificity level here is oftentimes missed as well by physical therapists. And the rehab EMOM idea that Mitch has come up with is so awesome. You'll see Alan posting it on his Instagram all the time. Patients just have so much fun doing these rehab EMOMs. So if you haven't played around with those, check those out. Mitch did a podcast on it a while back. It's also a great listen. So there you have it. That's the CrossFit Shoulder. That's the kind of clinical presentation that these individuals come to me with, how I go about assessing them, and what I see what I see tends to work the best from a treatment perspective. If you want to learn a little bit more about treating the fitness athlete, then you need to check out the courses that we have within ICE Physio. So we have 3 different courses: the Essential Foundations, our live weekend seminar, and Advanced Concepts course. So the next courses we have coming up on January 12th and 13th, Mitch will be in Minneapolis, Minnesota. That same weekend, January 12th and 13th, I'll be teaching in Charlotte, North Carolina. So you got 2 opportunities to hear us talk about that in January. And then on January 20th, our Advanced Concepts in the Clinical Management of the Fitness Athlete cohort starts. And that's a completely online course where basically we take individuals that are already really familiar with the movements performed by CrossFit, and we try to teach them some incredibly advanced skills that would completely separate them from any other practitioner in their area so that they become the go-to resource for fitness athletes. Hope everybody has a great Friday and a great weekend. Hope to see you at courses in the future.